This discussion is sparked because I'm currently working with a patient who had an adipose stem cell treatment, and the physical exam on him was pathetic. Hey everybody. So even in the regenerative medicine space where doctors and physicians are using orthobiologic treatments, whether that's prolotherapy, PRP, autologous stem cell therapy, perineural injections, whatever it is, when we're working outside this, the conventional cortisone injection and surgery model, it is still utterly crucial that the physical exam be placed on a pedestal. Because this is the reality. If your pain is, let's say, coming from your sacroiliac joint, and the physical exam and evaluation does not properly elicit that, and you have an MRI that shows maybe some disc degeneration with some what's called lateral stenosis, so basically a narrowing of the canal where the nerve root comes out, which pain from that nerve root compression could look very similar to pain from sacroiliitis. But if the doctor does not do a good enough physical exam to differentiate between the lateral stenosis causing the radicular pain versus sacroiliitis, and he goes in and he does a nerve hydrodissection or a transforaminal epidural around that nerve root, doesn't matter what the product is. It doesn't matter if it's cortisone. It doesn't matter if it's stem cells, PRP, 5% dextrose. It does not matter. If the incorrect structure is treated, you are less likely and highly unlikely to actually get a result in the treatment because you're not directing the treatment at the structure that is contributing to pain. Now, there are instances where the treatment can be strong enough of a hammer that it comes in and it affects more than just the area that was injected. And so we do sometimes see this with steroid injections, where one good classic example is a steroid injection is done for the sacroiliac joint, but in the process of that injection, some of the steroid leaks out of the inferior aspect of the sacroiliac joint, and that actually reduces some inflammation around the cluneal nerves, but it still doesn't actually treat the cluneal nerves. And so if that person, they know that, the steroid injection for the sacroiliac joint was beneficial and helped my pain a little bit, so I'm going to go get a radio frequency ablation to the SI joint, and then that doesn't work because that doesn't actually treat the cluneal nerves. The same thing can happen with stem cells, right? If you do an adipose treatment and you just put that adipose inside the sacroiliac joint and maybe into the ligaments surrounding the sacroiliac joint, some of that may affect the cluneal nerves, but it doesn't directly treat the cluneal nerves, and so the chance of that stem cell treatment being a failure is still pretty high, and you might not get as much. If you do see an improvement, it might not be as much as it could have been. And so this discussion is sparked because I'm currently working with a patient who had an adipose stem cell treatment, and the physical exam on him was pathetic. Straight up, the physical exam done on him by an MD was pathetic. I obviously got to review the notes from this patient, and the entirety of his physical exam, I'm gonna guess, probably lasted about 60 seconds, maybe 90 seconds to 2 minutes tops. But based on what he documented, the test that he did, 1 minute to 2 minutes tops was his physical exam, and then everything else was based off of imaging. And this man paid a lot of money for a stem cell procedure. For someone to only spend 60 to 120 seconds trying to figure out why this man is in pain, it's disgusting to me, okay? So if you are a physician in this space, any type of practitioner in this space, and if you do not spend an enormous amount of time trying to figure out why your patient is in pain, it doesn't matter what the hell you inject into that area, you are less likely to get a response if you are not treating the pain generator. If you are a patient, please, please, please do homework. Call the office. Find out how much time the practitioner spends trying to determine what your pain generator is. How long does the physical exam take? To give you kind of an average, if somebody comes in with a single joint problem, let's say it's a knee joint, my physical exam is at a minimum going to last probably 7 to 10 minutes. if not longer, right? If it's a low back and it's a bit more of a complicated case, that might be 10 to 15 minutes of an actual physical exam. That means I'm doing maneuvers on patients trying to determine, does this cause you pain? How does it feel when I do this? Oh, what about this? Oh, you have pain here, but if I change this, what does it do to your pain? Your doctor should be curious about what is causing you or your pain before a needle ever goes in you or a knife ever cuts you, because that is how we truly get pain improvement and potentially resolution, is by figuring out what the hell is causing your pain, and then we actually do something about it. See you later.